first Fireside chat hosted by Scale Up Naturopath, which is a digital technology company focused on supporting the growth and development of the naturopathic industry across Canada. My name is Dr. Christina De Avila. I am a naturopath and certified diabetes educator, and I will be your host today. And it is my absolute pleasure to introduce our guest today, which is Dr. Scott Clack. And he is a graduate of Bastyr University. He's been practicing as a naturopathic doctor since 1997. He started his special interest in treating allergies in 2000. He's one of the first naturopathic doctors in Ontario to be trained through Defeat Autism Now in 2005. Dr. Clack enjoys treating autism and ADHD, plus other learning and neurodevelopment disorders as a biomedical practitioner, and continues his training with MAPS. He's currently accepting new patients, including for general or family healthcare needs. So welcome, Dr. Clack.
Thank you, Christina.
So our topic today, given everything that's going on, that is ever changing and evolving, this COVID-19 situation, are immune boosting practices. And we really want to speak today to the people who are at home and maybe don't really understand, what is the immune system, or they want to get a better understanding of how they can better support not only themselves, but also the people around them in terms of all things health and well-being. So
right.
Just to get started, Dr. Clack, I'd really like to get a sense of, let's get down to the basics and how you would explain the function of the immune system and why it's so important.
Well, the immune system, particularly as it should be producing white blood cells as a response to a person being exposed to a virus or bacteria or some other type of microbe, we need that immune response to mount, to increase, so that those particularly white blood cells are going to go through the blood, go looking for the bad guy, grab it, either kill it or pull it out and get it out of circulation. So it's bringing the person's body back to control and fighting off the virus. More and more these days, we're seeing many circumstances in somebody's lifestyle that's going to reduce their ability to do that. And being in the middle of this crisis is really, a good example of when that's going to happen. So that's why this discussion is so timely. As you put it, we want to be able to help the public, help our patients better understand what can they be doing to decrease their susceptibility against infections, and how do they fight it better.
Yeah. And I think the key point there, Dr. Clack, that you touched on was the lifestyle piece, right? I think we often forget about that. And, with everyone being at home, doing our part in social distancing and really trying to flatten that curve, what lifestyle and behavioral practices would you really sort of highlight or encourage at this time?
Well, this is a good opportunity to hit our patients about all of the basics of just healthy living. So we're going to be talking to them about their diet. We're going to be talking to them about their sleep and to some degree some exercise. And then the last component is, are they taking care of essentially their mental health side, which for some people, they might call that a spiritual aspect, but spirit and the mental health piece go together. So it's those foundations.
Mm-hmm. And, again, with the mental health piece, this is definitely a disruption to almost everybody's day-to-day routine and, figuring out, what does tomorrow bring, right? And for people who maybe already have, a predisposition towards anxiety, or, people who are now struggling with new anxieties and even just stress. How do you see that impacting the immune system?
Well, the research is very clear that when we are in a very high stress mode, we are going to chip away at the function of the immune system. We're not going to have as good immune reserve behind us. And so we're going to be able to bring that immune function back up to a good level where we need it to do the right level of surveillance. Grappling with the stress is one of the things that we have to attend to. You know, and different people will manage and deal with stress in different ways. A lot of people will do it by exercise. So of course, in this current situation, we're being told even not to go outside and not to exercise. And I'm not sure that I saw on a TV program yesterday, a news program, somebody running back and forth on their balcony and trying to do the equivalent of a marathon. I mean, good on them. I'm not sure that that's exactly going to help everybody out, but it's a good example to set. You know, and we can certainly, now that we're getting to more spring-like weather, we can be going out safely, walking outside where we probably haven't been doing that, in a combination of fresh air as well as doing something physical that will help us to get rid of stress. Being tuned out to the news, not constantly listening to what's happening around the COVID-19 infection. Taking media breaks, as they might be called, is another good way of just lowering your stress level and not being in that constant fight or flight mode around it. I mean, yes, there's lots of discussion that news changes every hour, but in reality, if you watch it 12 hours later, you're going to get the compilation of everything in one go, as opposed to fretting over it for 12 hours. So that's a good way of reducing your stress. And just being active, getting things done. So using time during the day to, whether it's the children doing their schoolwork or reading a book, which most of us never get enough time to do, but taking those time, you know, taking that time, all of those things, distracting us away from the news will reduce our stress level, make us feel more comfortable, and then our immune system is going to be able to fight that.
Yeah, I couldn't agree more. And definitely shutting it off, you know, before going to bed, because when you're going to bed with those thoughts running through your mind, right, then it's going to impact that sleep quality, which we also know will impact the immune system, right?
For sure. Mm-hmm.
Yeah. And I think one of the biggest questions really floating around is, you know, the role of, you know, not necessarily just naturopathic medicine, but also, you know, different supplements and what's available out there that can still target the immune system, support our defenses, our resilience around it. So what is your take in terms of the additional support that is available out there?
Okay, well, first off, I want to go back a little bit on the basics, just very simply make sure that we are talking to our patients and ensuring that they're eating a whole foods diet. I mean, when I have gone shopping and I've seen certain grocery stores and where they've been wiped out, it's in the processed food section. So I want to make sure that the patients understand that, yeah, these are different circumstances, but it's not a vacation either. So they need to be eating whole foods. They need to be eating well. I want to make sure that they're sleeping properly, that they're getting, if it's an adult, it's 8 hours. If it's a child, it's 10 to 12 hours of sleep a night. And if that's being affected in any way, then we maybe need to be introducing some ideas to help them sleep, whether it's just simply magnesium or some sleep herbs like, you know, chamomile before bedtime. We talked about the exercise and the spirituality, so that piece, you know, we've hopefully addressed that one. Now, somebody asked me the other day, I was in picking up some supplements for a patient to mail out to them, and the store asked me, what am I taking? My basics are vitamin A, through beta carotene to start, but you can take vitamin A. There's vitamin C. Zinc is a good necessary mineral for bolstering white blood cell production. And then on the stress management side, I'm taking herbs like ashwagandha and holy basil to help my body manage the stress and lower the cortisol level, which is a big part of what impacts on immune function. And then, of course, we've got many herbal medicines that have some antimicrobial activity, whether you're talking about the good old standard echinacea, there's golden seal, there's wild indigo, olive leaf extract is another good one. So there's multiple herbs that we could be thinking of, just maybe taking one dose a day as constant dosing throughout the day, just to keep the immune system primed, a little bit more on alert. And then when somebody does come down with something, whether it's COVID-19 or whether it's, what more likely people are going to get hit with, which is just a standard cold virus or flu, because those are still going around.
Of course.
Then upping your doses to more standard therapeutic doses with those immune stimulating herbs will be helpful.
Yeah. And I think, what you've highlighted there is that there's so much in our repertoire to pick and choose from, and be effective at stimulating the immune system or supporting the individual wherever they need. And I think, from a naturopathic medicine perspective, this is where we really shine, to really take the individual that is sitting in front of us and, creating a formula that is best suited for what they are coming in with. So when you are sort of picking these different options, whether it's herbs, vitamins, what is running through your mind when you are kind of considering the person in front of you and, putting forward a recommendation?
So I'm going to be listening to their symptoms. And I'll probably, like many of us, would be deducing, yes, you either have a weaker immune system, and maybe that's all. There's no sneezing, coughing, etc., that you might also want to treat. So then you are staying to the side of just keeping their immune system running well, trying to help them lower their stress level. But it's important for us to remember that we also have a lot of great supplements, natural medicines to recommend for patients for the symptoms that are going to come up with some of these infections. We have great herbs or homeopathic formulas for somebody that are dealing with a cough. One of my favorite herbs that I found out early in my practice when I had the first chance to treat somebody with pneumonia was pleurisy root, or Asclepias. And it's a wonderful herb to promote expectoration, help the lungs clear up and out to get rid of whether it's bronchitis or pneumonia. It's effective. Might be harder as an herb to find in some formulas that might be available, at the retail level, which is where, most people are likely to go, where we're dealing with our patients by telemedicine or by telephone. But it's trying to find those kinds of formulas that'll help people get rid of that cough to expectorate more efficiently, that I will be recommending. And I also want to remember, I'm a big fan of recommending hydrotherapy treatments for patients. And this is a really good example that when either somebody can't get out to a store, or for some reason, they're just not up to taking a lot of supplements, they don't like the taste of herbs, then there's the dreaded or infamous warming socks treatment. I mean, when I talk to my patients, I'm blunt about it. I just call it the wet sock treatment, which is what I was trained to name it as. But I've proven it on myself that by doing wet socks at night, it creates an artificial fever, your body warms up, the mucus thins out, and you actually have a really great night's sleep because you're breathing better through that. But it also does bolster your white blood cell count and is helping to fight the infection. And the other form of hydrotherapy that I will recommend to people is just go fill up a bathtub, with warm to hot water, throw some Epsom salts in there if you've got them, but just to rest in that hot bath again for 15 or 20 minutes, raise your core body temperature, and remind people that as your body temperature goes up, it kills off viruses and bacteria. So 2 weeks ago, I did the experiment. I did a bath at home, and I raised my oral temperature from 36.9 to 37.6 Celsius in a 20-minute bath. And that's the kind of thing that can just give the The immune system, that extra support, kill off some viruses so it's not going to have to work, but a great and easy treatment, particularly while people are at home.
Yeah, and easily accessible, right? Like
Yeah,
just turn on the
like
tap.
anybody can do that. And I don't know a lot of people that, don't mind crawling into a bathtub a
Yeah.
couple of times a week just to help themselves out.
Yeah. And I totally agree, Dr. Clack. I've done the wet socks. It's very uncomfortable, but overnight relief for people who have a lot of congestion. So it is quite incredible for sure.
Yes. Yeah. And then we got to remember that we've got homeopathic remedies. What's the single remedies? We've got homeopathic formulas. So for family that are dealing with kids, kids are, obviously don't do very well with swallowing pills at the best of times. Tinctures can be definitely on the yucky side, and you don't need to be chasing them around to get that in. So don't forget, you've got that line of natural medicines to be able to use for them. And there's great products out there from several different companies that would be very helpful here.
I'm so glad you touched on that, Dr. Clack, because I was going to ask that for all the parents out there who, can struggle with bad tasting or, not being able to get things into their children. So that is great that, there is a variety of options, and it's a matter of being creative as well sometimes with the little ones.
Even with adults, you need to keep it in mind that some of our patients out there are already on different medications, maybe on a handful of supplements, and they don't want to stop them. And that likely is appropriate, but they're just saying, I'm already at my limit. I can't take any more pills. So even the homeopathics are very effective for adults. Mm-hmm. Sometimes some people respond even better to them.
Yeah. Yeah. And I guess, you've touched a lot about, the diet, the lifestyle, the contrast hydrotherapy, or even taking hot baths, the wet socks, the homeopathics. Is there anything else that you at this time when you think of the immune system, is something that you, include in your conversations, whether it is with your patients or to anyone that you are talking everything immune system?
Well, we're still in an era where we're teaching people, and to some degree, even as practitioners, we're still learning and understanding mindfulness. So, taking time every day, whether to do, 2 spots, 5 minutes each of doing deep breathing, or going out and, since you've got the time, if you're not into meditation or something like Qigong or yoga, there are some opportunities to learn that, to find something that fits for you and begin to practice it. And again, that's a very stress reducing way of going at things with meditation. You could visualize boosting, seeing more white blood cells developing in your blood, visualize that, and it can happen. Mm-hmm. You've got that to work with. And we're not just worried about ourselves, we're worried about other people out there. So take the time to make a phone call to other family members, to friends or business colleagues, particularly, and this is an excellent time to be thinking about who might be out there who's living alone. Mm-hmm. And they're just not in contact with a lot of people. So, pick up the phone or do a Skype or a FaceTime connection with those people, and, think of something before you go in to, that you can talk to that hopefully will raise their spirits, get them again off the gloom and doom of what's happening. Yeah. And whether it's bringing, talking to them and bringing back great memories, and tying it in with this is the way it will be again, but just being in contact with somebody so they've got that connection. It's not as good as a face-to-face as we understand from the research, but we're certainly hearing the messaging out that we need to take care of the people that don't have somebody else that they're living with that they're not in contact with.
Yeah, I think that is really important considering we are social beings and we know that our social health has such a great impact in these different areas of our health. So I'm glad that you highlighted that for sure.
Mhm.
Is there anything else, Dr. Clack, that you would like to get out to our audience today as we come to the end of our session here?
I think it's again to be positive minded. There's so much that we can make out of this. Certainly, I keep hearing through the news people doing fantastic things, writing songs. Um, if you're again tapped on trying to find something to do to keep your mind off of it, maybe even meaning to write a story or write a book. Find some things that will distract yourself. Go back, and you haven't played an instrument for years, but you've got the instrument at home, then bring it out or get back to trying it again. But the more that we can stay away from the 24/7 news cycle, that it doesn't now I'm noticing lately it's not changing all that much.
Mm-hmm.
So I think again we can get away from that constant news stream and take the care to just enjoy life. And we know this is not going to be a short-term thing, but we have to think of it in a positive frame of mind. Start to plan out what are we going to be doing after we're able to get back outside that door on a regular basis as opposed to being shut in.
Yeah. Yeah. And, I think, time is something that we often are all strapped for. So, of course, is not the most ideal situation, but how can we maximize this time, this opportunity? And like you said, make it something that is, unleashing that creative juices, getting those instruments out or whatever it may be. So thank you so much. I really hope that, everyone is really feeling empowered and inspired with the information that's been put forward today, that there are still things that we can do at home to support our health, our well-being, to support everyone around us and still make, this a very positive situation. Given everything. So thank you so much, Dr. Clack. It's been an absolute pleasure. For everyone out there, please check out Scale Up Naturopath, follow us on Instagram, and share this video with anyone that you feel could really benefit from the content, and stay tuned for our next Fireside chat. So have a great day, Dr. Clack.
Thank you. You too.